All right, good afternoon. My name is Rachel McNeil. I'm with KPRC Channel 2 News. So my early risers, I start the news at 4:30 a.m. to 7 a.m. right before the Today Show comes on at NBC here in Houston. But I said this is probably one of the few groups I can actually speak to who completely understand how to function at a very high level with a very low level of sleep. So you guys feel my pain, I'm sure. You're trained much more efficiently than I was for this. But I'm also the health reporter at Channel 2, and I feel like I'm almost a third generation in the medical field. My father and grandfather were both doctors. My uncles were doctors. I was really the black sheep in the family when I went into television. Very disappointing. And then I married Dr. Wayne Franklin, who works at Texas Children's and Baylor College of Medicine. So yes, I'm very, very deeply invested and appreciative for the mission of this group, Doctors for Change. The things you're doing in this community and beyond are really spectacular. And it's all of those things that should really be on the forefront of the headlines and the newspapers every day when we're talking about access to care for all people of all ages, especially, as you know, in the Texas area, in the Houston area in particular. The need is so great. And the advocacy that you're doing is fantastic. And we know that no one could be a better advocate than doctors. You guys see it, you're on the front lines every day. So I'm really, really grateful that you asked me to be here today. Excited to do what I can to be here, and I'm really excited to learn more about your organization as well. So welcome to the 5th annual Doctors for Change Luncheon, Hope in Action. A quote from Helen Keller says that optimism is the faith that leads to achievement. Nothing can be done without hope and confidence. So we are here today to celebrate what has been achieved through the hope-inspired actions of local healthcare advocate Dr. Vivian Ho, and the hope-inspired work done by the leaders and members of Doctors for Change. As someone who is very, very proud to call Houston her home, I know that there are a lot of parts of our great city and our state that could really, really, really be improved. Issues like food insecurity, lack of access to mental health and primary care, and human trafficking. So today we're going to hear how DFC is tackling these issues by bringing health providers and allied health professionals into the public health and policy arena, serving as an educational resource and forum in which healthcare providers, students, and community members can really come together to advocate for change. So now I'd like to introduce you to Dr. Mitra Misra, Chair of the Board for Doctors for Change and Medical Director of Texas Children's Hospital Mobile Clinic Program.
Rachel, thank you so much for taking the time to be here today. It's an honor to have such a trusted face from local news here with us. And a very special thank you to Ms. Ginni Mithoff for serving as this year's Honorary Chair. Ginni, Houston is lucky to have you. You have improved the Houston community through your generous support of local organizations, and you undoubtedly will continue to improve Houston for many years to come. We're genuinely proud to have your support. We wouldn't be here today. We wouldn't be here today if it was not for all the individuals and organizations who have sponsored today's event. Thank you to each and every one of you for being here today. We are only able to continue our day-to-day DFC activities because of your support. Doctors for Change relies on the support of generous donors, but we are equally thankful for the time invested by its team of more than 40 volunteer leaders. I would now like to recognize the board members of DFC. I have the pleasure of leading our board of incredibly passionate professionals. Board members, if you can please stand. My dearest board members, thank you for attending all of our meetings, responding to all of our emails, and supporting our leadership despite your incredibly busy schedules. You are amazing individuals. Thank you for all that you do for DFC. And now, I would like to ask all of those who serve in a leadership position to carry out DFC's program efforts to please stand so that we may recognize you. and for organizing and leading all of our activities every day. We're here today, actually, to focus on hope in action. As an educational and advocacy organization, we continue to be incredibly hopeful that our actions will continue to make a difference. We are a unique group of professionals. Despite our various forms of expertise, we share a motivation to improve the lives of all Houstonians. We bear the responsibility to speak for those who do not have a voice. As we all know, our healthcare system is not perfect. However, DFC is a successful organization in making change. We have worked together as a family for the last 11 years to make changes systematically to improve processes at many levels. I am proud to be part of this organization. With that, I will turn it back to Rachel.
Thank you, Mitra. And now we are going to turn it over to DFC's co-president to present the 2017 Healthcare Advocacy Trainee Awards. Dr. Claire Bocchini, Pediatric Infectious Disease Specialist, and Dr. Padma Swawi, Academic General Pediatric Fellow at Texas Children's Hospital.
Wow, this is such a wonderful turnout. I can't thank you enough for all of your support and for being here tonight. I've been one of the original members of Doctors for Change since 2006, and to see this organization grow and just our luncheons are such a wonderful way of celebrating, and just to see all of you here, it's just really amazing. Thank you very much for your attendance today. We've had a great year. This is, we're on our year 11, and we've done more and more this year than we've done ever before. As one of the co-legislative advocacy directors, as well as a co-president, I'm particularly thankful for the many of you who traveled to Austin with us and worked in a really important session, a really tough session for a lot of healthcare issues, but we had some wins. And I just want to highlight the fact that our organization was very passionate about trying to minimize cuts to the Medicaid program. We did a lot of work around postpartum depression, and I think that our representatives actually and our elected officials did some really nice things for improving the identification and the ability for women who have postpartum depression to get access to mental health care. We also did a lot of work around mental health care in general and then also in human trafficking. So I think while there were some wonderful successes this past legislative session, there is a lot of work to be done, as always, here in Texas, and we're certainly up to the challenge. So I can't thank you for all the people who are in the audience who traveled with us to Austin. We met with we had hundreds of meetings with elected officials this year. We had more people travel with us to Austin than ever before, and I think we had a big impact, and I can't thank you enough for that.
As Claire just mentioned, our legislative session this year was a great success. And these efforts in conjunction with our activities of our committees truly exemplify hope in action. Our 4 committees, which have all been volunteer-led, and these professionals have busy schedules, and they have been managed out to carve some time to these activities. The accomplishments for the past year range from the county judge survey done by the Access to Care Committee, creation of a partnership with the Freedom House done by our Anti-Human Trafficking Committee, the art contest done by our Healthy Eating Active Living Committee, and education of teachers and in schools done by our Mental Health Committee. Our well-attended educational forums have provided our community with information on a wide range of information, such as physician burnout and healthcare provider burnout, to recognition of anti-human trafficking, and just so many different topics. And education has been such a key piece of DFC's activities. And the forums are one way in which we conduct this mission. Another way, I'm going to give the microphone, back to Claire to.
Yes, Padma and I have the great honor of introducing our trainee awards. And one of the most wonderful things about Doctors for Change is to see trainees, usually healthcare trainees, and I just do want to mention Doctors for Change, even though we're named Doctors for Change, we're actually an organization of all healthcare professionals. So we're very multidisciplinary, and we have trainees from across all the different fields who come to our organization to learn about healthcare advocacy and find out how they can incorporate healthcare advocacy into their careers. And this has been really a special part of this organization for me. I started off in this organization as a first-year pediatrics resident in 2006. And the mentorship that I had through this organization really helped me to learn how to involve advocacy into my career. So this is a wonderful award. We have so many trainees. We get lots of nominations. But I'd like to have Angela, Josie, and Caitlin please go ahead and come up to the stage because we have 3 very special awardees. So as they're walking up, I'd like to just give you a few words about Angela, Caitlin, and Josie, our this year's 2017 Healthcare Trainee Award winners. These are 3 third-year, or now almost 4th-year medical students at Baylor College of Medicine who sent me an email about a year ago, actually, asking for me to help them start a new Baylor College of Medicine health policy elective for students. And I thought, well, this is really interesting. This sounds like a great idea, but this is going to take a lot of work. And it's already, April, May, and we have to have the curriculum developed and ready to start the elective. And not only were they prepared, when they met with me, they presented to me a fully fleshed out curriculum with every lecture and every goal for the lectures and the whole plan. And they came to me and they said, we really want as medical students to be more involved in healthcare policy. We want medical students to be able to learn about how to write policy briefs and actually go to Austin and make a difference. And I was really excited about this opportunity, and I said, yes, I would love to help them. They did by far most of the work. They organized this course. We had about 20 medical students who went through the 6-month course, and they wrote beautiful policy briefs. I hope all of you actually went out and looked at the posters before when you first got here. If you didn't, on your way out, please look at all the posters. There's one poster specifically about the elective and all their accomplishments. But we basically had first and second year medical students write these beautiful policy briefs, then travel to Austin, and then our new policy experts taught our elected officials about all kinds of things. I have Representative J.D. Sheffield, a family physician from Gainesville, Texas, reaching out to me about how, learning a lot about school-based health clinics and interested in writing a bill on school-based health clinics next year. Caitlin and a group of students wrote a beautiful policy brief about immunizations. And we certainly have a lot of work to do on immunizations in the next few years here in Texas. We have policy briefs about human trafficking, about intergenerational family support services. This was just really some amazing high-quality policy work done by these students, and it had a big impact on the Texas legislative session. For example, we did have one group of students who wrote a beautiful policy brief about postpartum depression. This policy brief had a nice list of recommendations, was very well researched and well written, and they played a large role with many other organizations, but really helped Representative Sarah Davis's office write a bill, House Bill 2466, that now will allow pediatricians and family practice providers to be reimbursed for screening moms who just had a baby for postpartum depression and helping them access care. We know in the past few years, Medicaid, the governor actually signed that bill into law yesterday, and so as of September 1st, we'll see that happen. And that's a huge accomplishment for these students. They really, truly had an impact. Now, Angela, Caitlin, and Josie didn't stop there. They're really passionate about trying to improve medical student education around the social determinants of health and health disparities. So now they have worked with Baylor College of Medicine student education leadership to have 3 half-days in the new student orientation week that are purely devoted to teaching the students about social determinants of health and health disparities. That is a huge improvement in the curriculum. And they work with a team of first-year medical students to write brand new case studies, small group sessions for these topics, and they're wonderful. And they're not going to stop there. They're going to work on longitudinal experiences for the students, including field trips for all students to learn about food insecurity and then visit the Houston Food Bank. I'm just really excited. So Angela, Caitlin, and Josie, thank you for all of your work this past year. It's amazing to see your impact on the students, on our organization, Doctors for Change, and on Texas in general. I really wish you luck in the next year. And congratulations to you on this award, and I'm really looking forward to seeing what their careers entail. I know they're going to be using advocacy very nicely in their future careers. So with that, thank you, and I'd like to congratulate them.
announce and introduce the recipient of the 2017 Doctors for Change Healthcare Advocacy Award for her incredible dedication to improving the health of our Houston community. Dr. Vivian Ho is a talented researcher who is committed to addressing issues related to the cost and quality of healthcare. Her work has been significant in advocating for improved patient access to care. Her recent research, co-authored with Elena Marks and Stephen Pickett, showed that 1 million additional Texans gained insurance coverage under the ACA, and suggests that current proposal to replace the ACA removes substantial federal assistance from those subgroups that benefited most from the law. Dr. Vivian Ho is the James A. Baker III Institute Chair in Health Economics, Director of the Center for Health and Biosciences, and Professor in the Department of Economics at Rice University. In addition, she is Professor in the Department of Medicine at Baylor College of Medicine. Dr. Ho's research examines the effects of economic incentives and regulations on the quality and costs of healthcare. Her research is widely published in economics, medical, and health services research journals. Dr. Ho's research has been funded by the NIH, the Agency for Healthcare Research and Quality, and the American Cancer Society. She has served on the board of scientific counselors for the National Center for Health Statistics, as well as in being one of the NIH Health Services Outcomes and Delivery Study section members. She is a founding and current board member of the American Society for Health Economics, and a board member for Community Health Choice. Dr. Ho received her AD in Economics from Harvard University, a graduate diploma in Economics from the Australian National University, and a PhD in Economics from Stanford University. Dr. Ho, thank you for improving the health of our city and state. Please join me on this stage.
Thank you so much, Mitra, and thank you to Doctors for Change. This is a tremendous honor for me to be associated with an organization that is doing so much for the health of the Houston community. I am absolutely thrilled. It's a pleasure to come talk with you today. Before I make my major remarks, I just wanted to acknowledge a few people, because doing something like this is not a solo position. This is really requires the help and cooperation of lots of people. My husband, Richard Borland, is here today. He's also an economist at Rice University. He's not a health economist, but he has been such a wonderful sounding board for all of the research that I do in terms of health economics, and sort of brings me back to earth sometimes when I get a little bit too excited. So much so that we've had lots of vibrant discussions about the Affordable Care Act. It's so much that our son, who listens to it, he's an 11-year-old, and he now refers to Obamacare as Yo Mama Care. So he came up with that. Also, the organizations that I have worked with in Houston, I just wanted to mention a couple, but there are so many that are worthy, and I've had a chance to say hello to many of you here. Elena Marks was mentioned, and the Episcopal Health Foundation. If you haven't had a chance to learn about their work, I encourage you to visit their website. They're taking a refreshing approach to improving the health of Houstonians by looking at the entire community and funding all sorts of terrific work and research about how to go and not just focus on what goes on in the doctor's office, but what is the entire continuum, as mentioned as the awardees, about how socioeconomic conditions and the environment that people live in influences their health. And I couldn't have written all of the issue briefs. They really are collaborative projects with the Episcopal Health Foundation, particularly with Elena, who understands these issues so well, and was really the person who said, let's go do a survey of people in Houston and find out what's going on in terms of health insurance and health status. The other organization I wanted to mention is Community Health Choice. which provides managed care services to Medicaid recipients around Texas, but also has been a major player in terms of providing affordable health insurance to the marketplace to Houstonians, so that we are not one of those counties without insurance in the marketplace. And they've been a terrific organization. Ken pulled me in to help with their board, but in the process I learned so much about healthcare and how to provide health insurance to vulnerable populations. They're doing terrific work. And of course, the people at the Baker Institute, I work with wonderful people. A lot of our support staff makes all of these reports and things happen. And also we've got some young, terrific researchers there. Keonta Moore, you may hear more about her starting in the future because she's got some substantial funding from the Houston Endowment to look at the health of children in Houston by going to the HISD and the school district to collect information, but she's also doing work in the 3rd Ward to look at the health of the existing residents as these sort of inner parts of Houston gentrify, and what can we do to preserve the communities for these people and sustain a healthy environment as we go through a lot of changes to our city. We just also had Farhan Naji to join us this year, and he's a global health person. I only have time to work on domestic health, but you're going to see some really interesting things coming out of his shop in terms of looking at global health. And also, you know, I'm the person who sits at the desk with the big computer and analyzes large claims databases all day, which there is a purpose for this, but it's so tremendous to see the work that the doctors do, and a lot of the doctors in this room who are face-to-face with patients who are so much in need of health care. You know, we heard that Mika runs the mobile health clinic for Texas children, and going around to all these different parts of Houston where people wouldn't have access to a doctor otherwise, and trying to figure out what are the problems facing these people. Another person, many of you probably know him, and I ran into him earlier today, is Dr. Ricardo Nuila, who is a Baylor College of Medicine physician. And if you haven't heard of him, I urge you to Google his name. The last name is Nuila. He just wrote a terrific, he writes a lot of things, but he actually was featured in the New York Times Sunday Review May 26th, talking about the medical misfits and telling the stories of patients here in Houston who need help. And it was quite moving, this piece, because a lot of it he spends talking about a woman who's an illegal immigrant here in Houston, has been here for 26 years, and was fortunate enough to get a surgery that helped her in terms of a horrible cancer diagnosis she was facing, but then suffered a terrible infection, and she has no health insurance. And Dr. Nuila is sort of facing this woman who has something called trigangrene, and she's just forced to sort of wait while her limbs fall off. But it's not just the story of these patients, but it's telling the story of the patients so that we understand what is at stake as we are making our future healthcare policy decisions and what people are likely to lose. And I encourage all the healthcare providers that are here today to think about getting your story out. You know, maybe you're not going to make the New York Times Sunday Review. I certainly haven't yet. But, you know, to the extent that you can write something, even if it's in a blog. And of course, you know, we want to maintain privacy, but to get the story out, because I think there's so much debate going on today without people hearing the real stories of what patients are facing. And, you know, and I told Ricardo, I said, look, thank you for writing that story, because I need to know the faces behind the numbers. So I'm analyzing at my desk. So I want to talk about the current situation we're facing. In many aspects, it's not a good situation. We have a president who doesn't understand the healthcare system. When he first took office, I think, you know, more optimistic. I have a colleague actually at the University of Pennsylvania said, you know, maybe what he's going to do is say, you know, let's have universal health insurance and make the Canadians pay for it. So that unfortunately hasn't turned out to be the case. Instead, you know, after the House Project first passed their bill, you remember the quote, he said, who knew healthcare would be so complicated? And then they made a minor tweak to it, and they did get the House bill passed, the American Healthcare Act, the AHCA. And immediately after it was passed, he got up at the White House and said, oh, this is a terrific bill, it's fantastic, I fully support it. And then, if you've been paying attention, just earlier this week, he said he thought that same bill was a mean bill, and that he hoped that the Senate bill would be more generous. So we're waiting to see what will happen with that particular situation, and we're the Republicans have to do something soon because they can't spend the entire year looking at healthcare, and actually they've set themselves a deadline. So if there is going to be something that's going to happen, it is going to happen by, you know, sort of sometime by mid-July, because there was a break in August, and in the fall they're going to be forced to move on to the budget and tax reform. But for those of you who aren't keeping up with the numbers on a day-to-day basis, the Congressional Budget Office has done a careful analysis. They are nonpartisan, and they estimate that there will be 23 million people, 23 million more people who would be uninsured in 2026. These are 10-year projections out. 23 million more people who would be uninsured now relative to Obamacare, and it would only reduce the deficit by $116 billion. And I know $116 billion sounds like a lot, but when you think about the total amount we spend on healthcare each year is $3 trillion, so that's really a drop in the bucket. You're dropping this many people for a small savings. So what I'd like to do is just encourage you to let the facts, the economic facts and the numbers tell the story. And so let me just sort of give you some of the comments that I hear, or, you know, when you put a piece out and you sort of read the comments below. And some people tell me, oh, never look at the comments because it's, you know, people sort of way out and but, you know, it's worth it to see what's going on in their heads. And so when you talk about the Affordable Care Act, you will see the response, I work hard, I pay for my own health insurance, and now you're asking me to go out and pay for somebody else's. Why should I have to do that? Okay, keep in mind that the subsidies under the Affordable Care Act are all subsidized by certain groups. They are not funded by general income, so they are not funded by sort of the income taxes that most of you are paying. Instead, it's financed by taxes on the wealthy, and by that I mean people who are earning $200,000 a year or more if they're single, and then it's slightly higher if you're a married couple. And so it's financed through additional payroll taxes on them, on their Medicare payroll tax. It's fined on their net investment income, the 3.8% tax on their net investment income. Then, the other very large group of people who are subsidizing this are all people in the healthcare industry, okay? That means health insurers are paying part of the tax, medical device makers, and drug companies, all right? So they are the people paying for the subsidies under Affordable Care Act. I actually think that's really fair because these are the people who are actually getting huge amounts of revenue from additional millions of people getting health insurance, okay? So they were at the table when the legislation was written, and they did agree to these taxes, but now every chance they get, you know, they try and say, oh, I know we're supposed to pay a tax, but please hold it off for another year, because really it's not fair. But it is quite fair. And so, you know, some of you may disagree with taxing the wealthy. You know, you may have different opinions about income distribution. But I don't know. I think most of the people in the room might think this might be a good idea. So the other thing you will hear about, and this has been said both by Governor Perry and now by George Abbott, they talk about the Texas miracle. Okay, so the reason, you know, we have low taxes, and that's why our economy is so strong, and that's why we have so much capital investment coming into Texas, and you know, so this is a great thing that we just don't have high government taxes paying for all these services for people who you know, may or may not need them. Okay, so yes, we've had a dramatic increase in the population. It's now, I think, close to 27.5 million people in the state. By the time they do the next census, it could get up to 28 million people. But you have to keep in mind that as the state has grown, the percentage of people in Texas who are in poverty or near the poverty level has remained constant. Okay, so we've grown the population, but we've also grown the number of people who are in poverty. Okay, so this is the type of growth that we have to live with. It's not like we suddenly grew the population and everyone became rich. So to me, if you're talking about a real miracle, a real Texas miracle, it's as Mitra mentioned, we've done research, Elena and I, and conducted a survey and found that the uninsured rate for 19 to 64-year-olds dropped 5.9 percentage points between the end of 2013 and early 2016, so the time over which Obamacare was introduced. And so you can pretty much attribute that increase, that drop in the uninsured rate, insured rate, and increase in the number of term, which is just about under 1 million people in Texas who are now insured because of the Affordable Care Act. Think also about this. When we're talking about a miracle in the Texas economy, this is the same point at which oil prices began tanking. And a lot of people in the oil sector unfortunately lost their jobs. Okay? But the Texas economy has still been able to be going pretty good. It's not the best in the country, but it's still doing fairly well. Right? And when you think about the amount of additional money that is running around in the Texas economy because of additional federal money coming in and boosting really what's going on in the healthcare sector. So when you talk about people migrating in, a lot of those people are people coming in to take healthcare jobs, new physicians, new nurses, and everything else that's going on. And you also look around at the different construction cranes. You've all seen what's gone on in terms of the building at the Texas Medical Center and in terms of all the hubs that have been going up, sort of out in the woodlands, down in Sugarland, Pearland. All the major healthcare organizations are building. And the reason why they started building that, part of it is because they see an aging population way down the road, but they said, hey, we're going to have a lot more insured people. They're going to have money to pay, and so we can start building a strong healthcare system, and that's something that they need. And so now, if we have the Affordable Care Healthcare Act or something like it passed, you can already see that there are healthcare organizations who are being hesitant. I don't think you're going to see any new announcements about new clinics or new hospitals being built, okay, until we get some certainty about what's going to happen in terms of coverage of people. So that's also a real danger. Another danger that is coming up, of course, is the expiration of the Medicaid waiver that Texas has had through, it ends in 2017, but we've gotten $29 billion in federal health care from that waiver, and it's now up for negotiation with Health and Human Services. If we lose that money, there are going to be substantial services in Houston that are going to be cut, and throughout the state. Lots of rural clinics. Everything that we've achieved in terms of progress in mental health care is going to disappear. Okay? So that's another serious situation. Another statement you hear from people is that government shouldn't make me buy my health insurance. By gosh, I'm an American and I should be able to do whatever I want, and no one should tell me whether I have to have coverage or not. All right. Think about why the government makes you buy car insurance. Right? Car insurance leads, sort of car accidents and owning cars leads to something that economists refer to as an externality, which is that if you go driving your car around and you unfortunately get in an accident and you can't pay the other person whose car you hit, well, then that's an externality. You impose a cost upon someone else where you're not able to pay. And so the same type of thing actually happens in healthcare. All right, so of course, we have a law called the Emergency Medical Treatment and Labor Act, which says that If you are in dire need of health care and, in really bad straits and you show up at a hospital, then they are required by law to assess you and treat you if you are in a life-threatening circumstance. And of course that leads to a lot of the expenditures that actually go on in Harris Health. That you and I pay for in terms of our property taxes, okay, and plus other people make donations to Harris Health, but most of it is funded by the property taxes, okay? So, the hospital uncompensated care, so this is only the hospital amount, and I'm sure there are physicians who actually have a lot of uncompensated care themselves. The total amount in the U.S. peaked at $46.4 billion in 2013. Which was the last year before Obamacare took place. And now the most recent figures are from 2015. It's actually down to $35.7 billion. Okay? So it's something like the Affordable Care Act that has taken care of part of this externality, which you and I, again, are funding through our property taxes, right? And there's been a good economic study by some prominent healthcare economists that looked at the uninsured, and based on their income and medical expenditures, they figured out that about half the people who were uninsured at that time actually could afford health insurance if you looked at their income, and they just weren't buying it. Okay, so these people who talk about my, freedom not to buy health insurance, I look at you and I say, unless you can't afford it, and of course there are people who can't afford it, and that's why we have the Affordable Care. But unless you can't afford it, you are a free rider, and you are free riding off of me and my tax dollars. Okay, so this isn't about individual freedom; it's a question about who is going to pay for these externalities when these people, show up at the doorstep of the hospital and are asking for care, and then aren't able to pay for it. One last thing I'd like to mention, and some of you may have heard about this, which is not national in scope. It's more Texas oriented. Is my work on freestanding emergency departments. And this started about 3 or 4 years ago. You've seen them; they're all over Texas. And they started popping up as sort of 4 years ago, I think. And then Carrie Feigl, if you remember her, she was a reporter at public radio, and she said, "Hey, I want to do a story on these. I'll come over and we'll talk about it." And I said, "Yeah, sure. They're popping up like Texas wildflowers." And then she said, "What do you think of this as an economist?" And I said, "Well, it might be a good thing. It's really convenient. But then if people start using them and they're really expensive, it's going to raise all of our health insurance premiums, as insurers start paying for this." And I had no data. I just sort of said that. But because I did that story, it actually went on national public radio. So every time a reporter Googled freestanding emergency department, they got my name. They would call me, and they'd call from all over the country. So then I could track. It's like, oh, you're in Ohio. That's interesting. Oh, you're in Florida. You're in Alabama. And then, I'd get a call like every 2 months. It was like, okay. Then all of a sudden, a couple of years ago, I started getting weekly calls. And there was one week where I got 4 phone calls, but they weren't from reporters. They were from venture capitalists saying, "What do you know about Adeptus?" which is a chain. I said, "I don't know. I'm not an investor. I'm a health economist." But essentially, I just got so upset that they're all asking me these stories, and I don't have any data. So I actually was able to partner with Blue Cross Blue Shield Texas and analyze their claims data because they cover 50% of people in Texas. And we published a paper earlier this year which shows that if you look at freestanding emergency departments and urgent care centers and their top 20 diagnoses, there's an overlap in 15 of those diagnoses. So 15 of the most common reasons people show up at freestanding emergency departments are also the same reason they go to an urgent care center. The big difference is in the price. And if you go to a freestanding emergency department, your price will be 10 times higher than if you went to an urgent care center for the same thing. Okay? So we published this in a journal, Annals of Emergency Medicine, and it is run by the American College of Emergency Physicians. And I made a mistake in the appendix of this paper. We were reporting some median prices. They have nothing to do with the main parts of the results of the paper. Those all stand, but they wanted some prices of median reimbursement prices for physicians. the American College of Emergency Physicians is not happy to see this paper out because they get a lot of income from treating patients who unsuspectingly show up at freestanding emergency departments. We corrected the results in the appendix. Again, the results still stand. And they used the mistakes in the appendix to say the entire study is unreliable and pull it from the journal and pull it from your website until we can do an independent third-party analysis of your data. That, so if you try and Google the article right now, you will not find it. But don't worry, we're actually, they then tried to come up with other criticisms of the study, and we have responded to those. So I'm very confident the article should be back up on the website, hopefully in a couple of weeks, 2 or 3 weeks. But what was interesting about the entire thing, part of me is like, oh gosh, I shouldn't have made that mistake. But part of it is, if you Google this now, there are all sorts of news media outlets who picked up on this because they realized, and the researchers know this, maybe you don't, but you don't pull an article because of a mistake in the appendix. You know, someone may get out and say, well, I disagree with this result, but and so it created such a hubbub that now the Washington Post picked it up. It's all over Twitter amongst a bunch of academics. There's a story in the Houston Chronicle, and then various different local news reporters and things that picked up about this. So the great thing is, even though I made a mistake and it's about pulling an article from a journal, there are lots of people who found out that they're not supposed to go to a freestanding emergency department. and that's the point. So again, you know, you get frustrated, you make mistakes when you're working with data, but as long as you're getting the message out, that's the most important thing. So, you know, those are my notions about how health economics and getting the numbers out affect the situation. I just want to say, you know, in spite of all the things we're trying to work through and work for, healthcare is still too expensive, all right? So the reason why we have people who are uninsured is because healthcare is very, very expensive and people can't afford it. So I just wanted to say, again, to wrap up, there are things, that is not the mission of this organization. It's not the major mission, and it shouldn't be. But I wanted to applaud the things that Doctors for Change is doing in terms of trying to encourage healthy behaviors, particularly among children. That is one of the things that's going to reduce healthcare costs, because so much of what we're paying for now is due to cardiovascular disease and diabetes, which resulted from poor health behaviors for children. And also to think about, when you're out teaching students, to try and reduce waste in the healthcare system. Okay, there are some studies that show that 20 to 30% of what goes on in healthcare is actually waste. So think about that when you're talking to your students. It's not always about just, oh, let's just do the new treatment whether it works or not. You know, there's a program out called Choosing Wisely, where physician experts have gotten out and said, look, the following tests, expensive tests in some cases, should just never be done on certain patient populations unless they have, you know, particular conditions. Those are the types of things that we can work towards, because to the extent we can just sort of slow down the growth in healthcare costs, we're going to have a chance at insuring more people. And so that's what I have to say to you today, and thank you again so much for your support and encouragement, and I look forward to collaborating with Doctors for Change in the future and many other organizations in the community.
Round of applause for Dr. Ho. Congratulations. Thank you so much. We appreciate your message and your work to improve the health of our community. Thank you. All right, so to bring this event to a close, in a few moments you're going to hear from DFC's Director of Operations, Leah Halley. But first, I'm going to invite you to just sit back and meet face-to-face the many people that make DFC's work possible.
Doctors for Change is an organization of healthcare professionals and community members established in early 2006 that works to increase access to care and improve the health of all in our community through research, education, collaboration, and advocacy. We believe healthcare providers have a unique ability and responsibility to advocate with their patients for improvements to the healthcare system. Since its founding 11 years ago, DFC has become an educational resource and forum in which healthcare providers, students, and community members can advocate locally and statewide. Our programs and advocacy efforts fall under the umbrella of one of 4 focus areas: access to care, mental health, access to a healthy lifestyle, and anti-human trafficking. This past year, the Access to Care Committee partnered with the Houston Public Library for our Doc Days program, bringing physicians and students into Houston public libraries to provide information on healthy living, health coverage options, and cooking demonstrations. The Mental Health Committee offered trainings to area school teachers on how to identify students with mental health needs, such as attention deficit disorder and depression. And for the 3rd year in a row, the Healthy Eating Active Living Committee hosted its annual Healthy for Life art contest for Houston area youth and created its first Healthy Living recipe and tip booklet from art submissions so kids could learn from their peers. Our Human Trafficking Committee offers trainings that teach healthcare providers and medical students how to identify signs their patient may be a victim of human trafficking, as well as how to safely intervene when a victim has been identified. They also bring together Houston area organizations working to end trafficking and raise awareness through partner events like Children at Risk's bus tours. This past spring, DFC began a partnership with Freedom Place, a recovery center for female child sex trafficking victims, to present monthly education sessions to the girls on everything from nutrition to coping skills. We believe advocacy is a key piece toward positive change. The call to advocate is interwoven into each of our program areas, and nowhere is this more apparent than during the Texas legislative session. This past year, DFC leaders mentored medical students in a health policy course called From the Clinic to the Capitol to develop policy briefs that were presented to the 85th Texas legislature on everything from immunizations to postpartum depression. We coordinated monthly advocacy days in Austin to give providers and medical students hands-on experience and to educate legislators on the impact of health-related legislation. In March, we had our largest visit since our founding, with over 60 healthcare professionals and students who met with 124 legislative offices. As we move forward into the remainder of 2017 and look ahead at 2018, clouds of uncertainty loom over the health of our Houston community and nationwide. Yet in these uncertain times, our shared hope for a brighter future inspires us to work together to improve access to care and give everyone the opportunity for a healthy life. By joining with us through your generosity of both time and funds, you will be supporting programs working at the root causes of our community's unacceptable health realities through education, advocacy, research, and collaboration. Together, our shared voice plants the seeds of change.
Good afternoon. I am Leah Halley. I'm the Director of Operations here with Doctors for Change. It is truly incredible to stand up here and see this room so full with all of you wonderful people. So thank you for joining us today. I would like to thank Rachel McNeil one more time. If we could have a round of applause for serving as our master. And to Ginni Mithoff, your support, both of our organization and, as previously mentioned, really organizations all across Houston. It can't be stated enough how much you have done for our community. So thank you for your support of us and all that you continue to do to make our community a better place to live in. And lastly, to Dr. Vivian Ho once more for joining us today, for all of your work. It is really kind of the combination of your research and the stories like those of Dr. Nawila that was also mentioned and is here today that really move change forward. So thank you. So I'm flashing back real fast to when I was a young girl. I remember picking dandelions out in the field and making a wish before blowing that fluffy white top, and hoping that as the wind carried those seeds across the yard, they also, were carrying my wish along with them. Now, as an adult, I know that wishing is not quite enough to make something happen, but hope is a different story. Rachel opened today with a quote from Helen Keller, that optimism is the faith that leads to achievement, that nothing can be done without hope and confidence. Hope itself really drives us to action. A farmer would not plant a seed if he did not hope that it would sprout and one day bear fruit. A traveler would not board an airplane if they did not hope it would fly and ultimately land at their final destination. And no medical student would spend hours studying and on rotations if they did not hope that one day they would be able to treat patients. We are here today because we have a shared hope. A hope that leads a group of 60 physicians and medical students to use their own time to travel to Austin and meet with 124 legislative offices. A hope that leads health professionals and medical residents to give up their Saturday volunteering at local libraries across Houston to educate the community about healthy living and how they can get health coverage. A hope that drives 42 volunteer leaders to invest more than 800 hours every year planning forums and community events, mentoring students to develop policy briefs, and strategizing new programs ultimately to create a healthier community. Our shared hope is for a community that has access to care, access to mental health care, and all those things in life that many of us take for granted. This is our vision at Doctors for Change, and we invite you to join with us in taking action that is invested in hope. So, at each of your tables, you will find a donation and volunteer card. Here it's clipped with a handy pen that you can take home with you. But as previously mentioned, our programs rely both on the generosity of your funds and your time. All the people in this room, you are part of an organization of people that believe in and hope for something better. If everyone here, I did some math, if everyone here donated just $20 today, those funds would support our educational forums for the remainder of 2017. If everyone here donated $50, it would fund monthly Doc Days community outreach events for an entire year. And if everyone here donated $150, it would allow us to expand our reach outside of the borders of Houston and across Texas by developing online training modules on everything from how to advocate to how to identify victims of human trafficking in the healthcare setting. Lastly, on the backside of that donation card, we are always looking for new leaders and new members to help us carry out our program efforts. We could not do this without the efforts of all the volunteers that make up our leadership team. So I encourage you to use your new DFC pens and complete that donor volunteer card, really considering how you might be able to join us in putting hope into action with either your time or your funds. You are part of a group that does not just wish for change, but allows hope to see it achieved. So thank you again for joining us. Around the room, there will be some DFC leaders. I think they should be standing any second with bags, gift bags to collect your donor/volunteer cards. There will also be a couple stationed at the back exit door as you walk out, so you can just drop them in there. If I'm having a flag from someone, the little brown envelope is yours to take home with you. Inside there is actually some flower seeds that you can plant to remind you of hope in action. So thank you once more for joining us today. We hope we see you at some of our upcoming events and that you help us put that hope into action. Thank you.